In October of 1998, a woman in her 30s checked herself into a psychiatric hospital in rural Ohio, flinching from blows no one could see and bracing for impacts that never landed. Trauma? That's a matter of interpretation. But the bruises were real, symmetrical, deep, spreading by the week. This is the case of Emily Calder, a clinical possession no one could explain. Welcome to the channel. If you love slow burn horror, hit subscribe so you never miss a story. Comment below from which part of the world are you watching tonight. Now let's go back to where it started. St. Jude Memorial sits at the edge of Appalachian Ohio, where the hills fold into themselves, and the nearest town is 20 minutes of winding road through forest, so thick it swallows sound. The hospital was built in 1934, gray stone and narrow windows, the kind of place that looks institutional even when you're trying to make it welcoming. The psychiatric ward occupied the third floor of the north wing. Most people in the area knew St. Jude, not because they'd been there, but because their grandparents whispered about it. There were stories, about the rehabilitation programs they ran back in the 50s and 60s. Cold War stuff. Experimental. The hospital never confirmed or denied anything, and by the late 90s, most of those records were either sealed or missing entirely. Emily Calder arrived on October 14, 1998, just after dawn. She was 30, worked night shifts doing data entry at a medical supply warehouse, lived alone in a rental house near the county line. No criminal history, no psychiatric hospitalizations, no substance abuse. When the intake nurse Angela Morales first saw her in the waiting room, Emily looked tired but composed. She wore a long-sleeved shirt despite the mild autumn weather. And when Angela called her name, Emily stood smoothly, no hesitation, and followed her down the corridor without asking where they were going. The bruises became visible during the preliminary examination. Angela asked Emily to remove her shirt, and that's when she saw them, dark purple marks running along both forearms, across her shoulders, one near her collarbone. They looked, Angela would later write in her personal log, like someone had gripped her, hard. Defensive wounds, the kind you see when someone's trying to protect themselves. But the strange thing was their symmetry. Both arms marked in nearly identical places, both shoulders, as if Emily had been defending against something that came from all sides at once. Angela noticed something else too, something she didn't write down until later. The bruises had a pattern to them, not random. The ones on Emily's left forearm formed a sequence like finger marks, but the spacing was wrong, too wide, or maybe too narrow in places, like the hand that made them had been adjusting its grip, learning. Angela asked her what happened. Emily looked down at her own arms with an expression that wasn't quite surprise, more like recognition. She said she didn't know who did it. She said she woke up with them 3 days ago, then again yesterday, then this morning they were worse. She didn't seem frightened when she said it. That was the thing Angela kept coming back to. No fear, no confusion, just a kind of patient acceptance, like Emily was reporting data. Dr. Benton reviewed the case that afternoon. He was 62, just 3 years from retirement, and honestly, he'd seen enough self-harm cases to recognize the patterns. But these didn't fit. The bruises were too uniform, too externally consistent. He ordered a full workup, blood tests, x-rays, a psychiatric evaluation. Everything came back unremarkable. Emily's vitals were normal. No signs of coagulopathy, no hidden fractures. Dr. Samuel Klein, the consulting psychiatrist, interviewed her for 90 minutes and found her lucid, cooperative, and oddly detached from her own condition. She answered every question directly. She maintained eye contact. She didn't fidget or avoid topics. Klein wrote in his notes that she presented as unusually compliant, almost mechanically so. They admitted her for observation. Room 3C, North Wing, 3rd floor. The room had been empty for 2 months. Before that, it had housed an elderly woman with late-stage dementia who'd passed away in August. The hospital had repainted, replaced the mattress, gone through the standard sanitation protocols. It was just a room. Emily settled in without complaint. Angela checked on her every few hours that first day, and each time Emily was either reading a magazine from the common area or lying on her back, staring at the ceiling, hands folded across her stomach. She didn't ask when she could leave. She didn't ask what they thought was wrong with her. When Angela brought dinner, Emily thanked her and ate methodically, finishing everything on the tray. It was around 9:30 that first night when Angela noticed the first anomaly. She'd been charting at the nurse's station when she heard a thud from down the hall. Not loud, but distinct. She walked toward the sound and found Emily standing beside her bed, one hand braced against the wall. Angela asked if she'd fallen. Emily shook her head. She said she'd had to move quickly. Angela looked around the room. Nothing was out of place. No one else was there. She asked Emily why she'd moved. Emily paused, then said quietly that she'd needed to get out of the way. Angela wrote it in her log but didn't report it officially. It seemed too minor, too subjective. The second incident happened the following afternoon during Dr. Benton's rounds. He'd been standing at the foot of Emily's bed, asking her routine questions about her sleep, her appetite, when she suddenly raised both arms in front of her face, wrists crossed, elbows bent, a defensive posture. Textbook. Benton stopped mid-sentence. He asked her why she'd done that. Emily lowered her arms slowly. She said she thought he was going to throw something. Benton frowned. He hadn't moved. He hadn't even gestured. He asked her what made her think that. Emily stared at him for a moment and then said very simply that she'd felt it coming. That night, Angela was walking past Emily's room when she saw her through the small window in the door. Emily was sitting on the edge of her bed, and as Angela watched, she flinched hard, jerking her head to the side and pulling her shoulders inward. Angela opened the door. The room was silent, empty. She asked Emily what had startled her. Emily looked up, eyes calm, and said she'd ducked. When Angela pressed, asking why, Emily said she didn't know. She just knew she was supposed to. By the 4th day, Benton started controlled tests. Nothing invasive, just observation. He'd have a nurse approach Emily with a blood pressure cuff, and before the cuff touched her arm, Emily would tense, her muscles going rigid a full 2 seconds early. He tried it with a pen light. Emily squeezed her eyes shut before he raised the light to her face. He tried fake stimuli, pretending to reach for her without actually moving. She reacted anyway, pulled back, shielded herself. And when he did touch her, sometimes she didn't react at all, as if her body was responding to something else entirely, something no one else could perceive. Klein returned for a follow-up evaluation. He suggested dissociative disorder, some kind of psychomotor response tied to trauma she couldn't consciously access. But even as he said it, Angela could tell he didn't believe it. The timing was too precise, the reactions too consistent. Klein started asking Emily about her childhood, her work, her relationships, trying to find the hidden wound. Emily answered every question the same way she answered all of them, calmly, directly, with that same detached clarity. Well, it was around this time that Benton started digging into the hospital's archives. He'd been at St. Jude since 1979, long enough to know that parts of its history were deliberately vague. There'd been a whole wing, Ward C, that had been used for something during the Cold War. Rehabilitation, they called it. Behavioral conditioning. The details were murky. Most of the staff from that era were dead or retired, and the records were incomplete. But Benton had access to the old storage room in the basement, where boxes of patient files sat in no particular order, some water-damaged, some misfiled, some barely legible. He found the file on a Thursday evening, October 29th. There was no name, just a patient number and a stamp in the margin that read, "Patient identifiers removed per Federal Review Protocol." No explanation attached. The file was from 1954. A woman, late 20s, Cuban immigrant, admitted with bruises and defensive wounds. The intake notes described her as calm, cooperative, unusually compliant. The medical staff ran tests. Everything came back normal. They observed her for weeks, and well, the same thing happened. She flinched before stimuli. She braced before impact. She moved as if responding to instructions no one else could hear. The file ended abruptly. One line, subject released. Symptoms ceased. Benton sat in that basement for 20 minutes just staring at the page. The fluorescent light above him flickered twice, and in that stuttering darkness, he noticed something else. Paper clipped to the back of the file was a single photograph, black and white, creased down the middle. It showed a hospital room, empty except for a woman's silhouette visible through the doorway. Her arms were raised, frozen mid-gesture, but the angle was wrong. Both elbows bent backward slightly, just enough to notice, just enough to make your stomach turn. He pulled the photo closer. There was something written on the back in pencil, nearly faded. Day 47, still responding. He turned the photo over again, studying the woman's posture, and realized with a cold certainty that he'd seen Emily stand exactly like that 2 days ago. He went back upstairs and didn't tell anyone what he'd found. By early November, something else started happening. A patient 2 rooms down from Emily, a man in his 50s being treated for severe anxiety, began showing odd behaviors. He'd be sitting in the common room, watching television, and suddenly he'd duck, just slightly, a quick dip of his head, and then go back to watching as if nothing had happened. Angela saw it twice. Another nurse reported that a different patient had flinched in sync with Emily during a group activity, even though they weren't looking at each other. The most disturbing moment came during a group therapy session on November 6th. 5 patients sat in a circle, Emily among them. The counselor was mid-sentence when Emily suddenly jerked backward in her chair, and 3 other patients did the same, their movements synchronized like a ripple passing through water. The counselor stopped talking. The room went silent. And then everyone just continued as if nothing had happened. Dr. Klein requested removal from the case on November 9th. He didn't give a detailed reason, just said he felt he wasn't the right fit for Emily's treatment. But Angela overheard him talking to Benton in the hallway afterward. Klein's voice was low, strained. He said he'd been having dreams. Not nightmares exactly, just dreams where he was standing in a room, and someone was giving him instructions he couldn't hear, and his body was moving without him deciding to move it. He said he woke up with his arms raised above his head, muscles aching like he'd been holding them there for hours. Benton didn't push him to stay. The hospital restricted access to the 3rd floor north wing. Fewer staff, minimal patient interaction. Emily remained cooperative. She followed every instruction, took her medication, attended her sessions, but the reactions continued. She'd be sitting quietly, reading, and then suddenly twist to the side, or pull her knees to her chest, or cover her head with both arms. When asked, she'd say she was doing what she was supposed to. That phrase, over and over. I'm just doing what I'm supposed to. Angela started feeling it in mid-November. She was doing her rounds one night when she had the sudden, overwhelming urge to step backward. No reason, no sound or movement, just a certainty that she needed to move. She did. And then the feeling passed. She didn't write it in her log, she didn't want to, but it happened again 3 nights later. And then again. Each time that same inexplicable compulsion, like someone had reached into her spine and pulled a string. By December, Emily's bruises were spreading. New ones appeared every few days. Her forearms, her shins, across her ribs. But now there were other marks too. Small circular indentations on her shoulders, evenly spaced. Benton photographed them and sent copies to a colleague at a research hospital in Pittsburgh, asking for a second opinion. The colleague wrote back suggesting covert self-harm, or maybe a rare clotting disorder, but the tests still showed nothing at all. When Benton examined the circular marks more closely with a magnifying lens, he noticed they went deep, deeper than surface bruising. The tissue underneath had compressed in a pattern that suggested sustained pressure, something holding her in place. On December 18th, Emily started reacting to things that didn't follow. She'd shield her face, arms raised, body turned, and then nothing would happen. No sound, no movement, no stimuli at all. When Angela asked her why she'd moved, Emily looked genuinely confused. She said she'd been told to get ready. Angela asked who told her. Emily opened her mouth, then closed it. She shook her head slightly and said she didn't know. The night of January 11th, 1999, Angela found Emily standing in the middle of her room, both arms extended in front of her, palms out, head turned away. Angela watched her for a full minute. Emily didn't move, didn't blink, just held the position, muscles trembling slightly from the effort. Angela asked her what she was doing. Emily whispered, so quietly Angela almost didn't hear it, that she was waiting. Angela asked what she was waiting for. Emily didn't answer, but her breathing had changed, shallow and rapid, and when Angela stepped closer, she could see sweat beading on Emily's forehead, despite the cool temperature of the room. Emily's fingers were splayed wide, tendons standing out along the backs of her hands, and there was a smell in the air, faint but distinct, like ozone before a storm. Angela left the room and stood in the hallway, and that's when she felt it, that pull, that certainty. She turned and looked back through the window, and Emily was still standing there, arms out, waiting. And for just a moment, Angela felt her own arms beginning to rise. The symptoms stopped on February 3rd, just stopped. Emily woke up that morning, and for the first time in weeks, she moved normally. No flinching, no bracing, no defensive postures. The bruises started fading. Benton examined her. Everything normal. Klein, who'd reluctantly returned for a final evaluation, found her entirely stable. She was discharged on February 9th with no official diagnosis. The final note in her chart, written by Benton, read simply, "No diagnosis finalized." Emily refused all follow-up, refused interviews, refused psychological monitoring. She went back to her rental house, back to her night shifts. Angela tried calling her once, 3 weeks after discharge, just to check in. Emily answered, said she was fine, and politely asked Angela not to call again. Her voice sounded different, flatter, like she was reading from a script. Benton retired in 2001. He kept a copy of the 1954 file in his personal papers, including the photograph. He never told anyone else about it. Angela left St. Jude in 2003 and moved out of state. She still has her handwritten log in a drawer somewhere. She doesn't look at it. But sometimes, late at night, she'll be standing in her kitchen or brushing her teeth, and she'll feel it. That pull, that instruction she can't hear, and her body will move, just slightly, adjusting to avoid something that isn't there. The third-floor north wing of St. Jude Memorial was remodeled in 2006. They sealed off Ward C entirely, turned it into storage, and sometimes the night staff still report feeling it. That sudden certainty that you need to move, that you need to duck, that you need to get ready. They don't talk about it during the day, but at night, you see, when the hospital is quiet and the forest presses close against the windows, they understand what Emily understood. Your body knows something's coming, even when nothing ever does. And the worst part, the part no one wants to say out loud, is that maybe it already did. That's all for tonight. You can turn your light off now, but before you do, pay attention to your shoulders, your hands, your breath. If your body reacted before your mind did, you're already part of this, because that was how it started back then. Not with fear, but with a reaction you couldn't explain. We'll be back next week, same day, at 3 a.m.